Thanks for that question. It's a great question. So, I think as we think about innovation in pacing, rather before you go into the specifics of leadless pacing, you got to kind of take a step back. And the perspective we have had is that you really have to focus all the innovation in pacing around patients and what they get out of the therapy. And so if you look at 65 years of changes in pacing, what I'd say is you could categorize them in two ways. First, things that make a pacer act more physiologically. In other words, what are the things that a pacer can do to actually recapitulate a normal heartbeat as best as possible? Right now, we'll talk a little later about conduction system pacing. But the other piece that's important here is how do you make the patient experience better? And that's where Micra and leadless pacing fit in. And so what we're talking about here is shrinking the size of devices. Original devices were the size of a hockey puck. Our traditional pacers are now the size of an Oreo cookie. Micra is the size of a vitamin tablet. It's that much smaller. The other things are longevity, making sure the reliability is great, the ability to communicate so a patient doesn't have to go to the physician's office. All these things have been changes brought to pacing to improve the patient experience. And I think Micra is like a step function in that. And why do I say that? What we did with Micra is got rid of the need to put a device under the skin in the chest and bring wires down into the heart by getting rid of the wires and shrinking everything else to the size that you could put it directly in the heart. And that's been an incredible improvement for the patient experience on many fronts. And so I think how that's then shifted the perspective further is that, look, even in a mature environment like pacing with a 65-year history, there's no end to what you can do when you focus on those aspects for patients. And you could always make changes, oftentimes ones that are completely disruptive to a space. So first off, traditional pacers with leads work very well with very low complication rates. That said, the presence of the leads and the presence of having put the device under the skin are the biggest source of the low level of complications that exist. So pocket infection is one, and lead performance. And so the question was not, how do you make a faster horse? It's just how do you make a car, if you will. So the idea with Micra was, if those are the two places that drive the greatest complication rates, let's just get rid of them and shrink it down, put it in the heart. And so what we've seen is really dramatic improvements in complication reduction. Every single one of our studies we have done has suggested that leadless pacing with Micra drives complications about 50% lower than leaded systems. Again, these numbers are both really low, but anything you can do is great for patients. I think the other thing I'd say is those are objective numbers. There's a subjective component here that's important as well. And that is, when you don't have a scar on your chest and a bump from the pacemaker, no matter how small it is, what's gone is this constant reminder that you need a pacemaker or a device. And I think from a health perspective, patients can get treated for their slow heart rates and feel better without a constant reminder that they have an illness and they have a problem. And I think that is really powerful. We hear it from patients. We don't know how to measure that per se, but I think it's a very real and important thing. And I think when from my experience when I was in practice, when you offered a patient a Micra leadless pacemaker or showed them a regular one, it was kind of a no-brainer for them that they wanted to go with the smaller, simpler device. There are a couple of things that drive patient satisfaction with leadless pacing that's been very positive. First, these procedures tend to be short. What we have seen in some of the subset of the procedures that go through the neck instead of the groin area, patients need very limited anesthesia, so they can actually just get up and walk off the procedure table And some of them go home the same day. That's really powerful. The other thing is, because there's no pocket or leads, there are very few limitations for that early period after implantation. Oftentimes people will restrict activity like golf after a traditional pacemaker for about 6 weeks. That's unneeded. And then again, I think as I mentioned in the last answer, the perception of illness is different. You don't have a reminder, so patients just feel better. For example, I had one patient who, when I told them they needed a pacemaker, said, okay, does that mean I need to sell my home and move into a nursing home? And I said, why? And they was like, well, pacemakers are for old people who are debilitated. And I said, well, that's not true. The pacemaker is going to make you feel better and allow you to do more. But that perception of illness that comes from having a scar is there, and it's real. And getting rid of that is this intangible that I think is very meaningful for patients. One of the things we wanted to do with Micra was give it the ability to be offered to as many patients as possible. And I think one of the key considerations for any pacemaker choice is battery life and longevity. And by making Micra at parity to traditional systems, or even lasting longer, I think that revolutionized how you could think about who can benefit from a Micra. And so, for one, if you look at the typical patient who needs a pacemaker and look at their age, we are now at a point with the current version of Micra where about 80% will not need another pacemaker. Their pacer will outlive them. And so that provides a certain simplicity of saying, look, we've got this device, no scar, straightforward to put in, very low complication rates, and guess what? This is it. We're offering you a solution, and for many, this is all you're ever going to need. I think the other end of the spectrum is there are some young patients who we want to bridge to the next pacer need, and be able to tell them, hey, a Micra device can bridge you to either the next pacer, no matter what type it is, now for 15 to 17 years is a very powerful statement and opens the door for Micra to be used in younger populations. We are super excited about Elevate, and I'll even mention another trial we're working on as well. But I think the way I'd say it is, if Micra as a leadless pacemaker redefined what a pacemaker is, Elevate redefines what a pacemaker can do. And so why do I say that? What we're doing in this trial is we're asking the question, in a patient who otherwise doesn't need a pacemaker, but has heart failure with preserved ejection fraction, is there a benefit to slightly raising their heart rate over where it exists? It's a really interesting question, a really interesting approach. It's based on a smaller study that showed very positive results from taking this approach. And I think the trial is really cool on a couple levels. One, it would be a paradigm shift in how we treat patients with HFpEF. This idea, for a long time, people thought we should slow the heart rate down, and now we're learning that maybe it's the opposite that's true, at least in a subset. And secondly, it's personalized. How you set up the pacemaker is not the same for everybody. It's based on the individual's cardiac performance and their size. And so what's really neat about that is that women are favored in this trial, because oftentimes women get undertreated because when you choose a device, it's set for the average between a man and a woman, which means you may be overtreating a man and undertreating a woman. In this case, since everybody gets their personalized heart rate, everybody gets what we hope will be the same opportunity to benefit. Thirdly, it's using this novel approach called conduction system pacing, where we're tapping in to the heart's internal electrical system to create the most normal heartbeat to allow this occur. And I think fourthly, it's a super interesting idea to create a whole new indication for a pacemaker, which is a very well understood technology, rather than trying to bring to a population with as much need for therapy as the heart failure with preserved ejection fraction population, and say, oh, we're going to introduce a whole new device with a whole new set of unknowns. Here we've got a device with a lot of knowns, and now we can bring it to them. So I think it totally redefines how we think about pacing. We're also doing a study with in collaboration with a company called Orchestra Biomedical to look at whether pacemakers can reduce blood pressure in those patients who actually have an indication because their heart rates are slow, but also have uncontrolled hypertension. And I think when you add these trials together, what you really kind of get is this idea of maybe we have underrepresented what pacers can do to help people. And if you think about what this could mean, it could be that in 10 years from now, the current pacer indications, slow heart rates, may be a minority of what we use pacemakers for to treat, and that it will be much broader. So those are really exciting things to me, and elevate is kind of a bit of the tip of that iceberg.